Are you unsure whether the new code for obesity class 3 should be reported in conjunction with the code for morbid obesity? Today's ICD-10 quick coding tip answers the questions surrounding the use of the new obesity class codes alongside codes that further specify the type of obesity. My name is Claire and I'm an inpatient coding auditor and educator. In my quick tips and tricks videos, you'll discover valuable insights to help sharpen your medical coding skills and code with confidence. If that sounds like something that would be helpful to you, please consider hitting that subscribe button so that you can be notified whenever I release new content. New codes were added to the classification system for fiscal year 2025 updates on October 1st that provided more specific codes for a patient's obesity class. Previously, there was coding clinic advice that stated that class 3 obesity is the same thing as morbid obesity. And now that we have codes for both morbid obesity and class 3 obesity, this raises the question of what coder should do if a physician has documented both class 3 obesity and morbid obesity in the medical record. For example, if the documentation in the H&P states class 3 obesity and the documentation in the discharge summary states morbid obesity, should the coder assign both codes for the obesity class 3 and morbid obesity due to excess calories? This question has finally been answered with the April 1st ICD-10 updates. A new guideline was added clarifying the use of obesity class codes, and the guideline specifically addresses cases where both class 3 obesity and morbid obesity are documented in the medical record. According to the guideline, if both class 3 obesity and morbid obesity are documented, only a code for class 3 obesity should be assigned as it is more specific. So for the previous example of the documentation in the H&P stating class 3 obesity and the documentation in the discharge summary stating morbid obesity, the coder should only assign the code for obesity class 3. This is because morbid obesity is always classified as class 3 obesity, and according to the guideline, class 3 obesity is the more specific code. Now, what about coding other more specific types of obesity along with codes for obesity class? The guidelines address that as well. According to the guideline, the obesity class codes can be reported with other obesity codes in the classification found in chapters 4 and 15 to fully describe the condition. Let's take a look at an example of when it would be appropriate to assign both the specific obesity code and the obesity class code together. In this example, the H&P states class 2 obesity, and the documentation in the discharge summary states obesity due to disruption of MC4R pathway. Should the coder assign both obesity class 2 and the code for the obesity due to the disruption of the MC4R pathway? The answer is yes. Both codes should be assigned when both conditions are documented. It's necessary because individuals with obesity due to disruption of MC4R pathway may fall under class 1, class 2, or class 3 obesity. So both codes are required to fully describe the patient's condition. So that's it for today's quick tip. I really hope that this video was helpful for you. If it was, please give it a thumbs up, and if there's any topics that you would like me to cover in the future, just leave a comment below and I'll add them to my list. Thanks for watching, and until next time, happy coding.